Bladder cancer is a frequently occurring malignancy. However, it is still underrepresented in terms of scientific awareness. What kind of treatment options do you think could in the future improve bladder cancer management?
Well, you're totally right. Bladder cancer in Germany is even the second most common malignancy in men and the eighth most common malignancy in women. So we have approximately 25,000 new cases and the prevalence is much higher. But nevertheless, it's still not so famous, well-known, even in the people outside, like prostate cancer, you know. Prostate cancer is very prominent. Bladder cancer is not so sexy like prostate cancer. This one reason might be that many very famous people all over the world it is known that they have prostate cancer. But I don't know any kind of patient very prominent patient who suffers from bladder cancer. Probably if the awareness in the outside and the people will grow up regarding bladder cancer, probably we are forced to do more science even in bladder cancer than in prostate cancer.
Are there any trends in bladder cancer treatment?
Well, yes, I think the incorporation of the molecular biology, this will be the focus for the near future, because personally I think we have a two-path model in the behavior of bladder cancer, but nevertheless, in the near future we will have so many subgroups in this pathway model that we will be able to treat our patients right more according to their biological behavior instead of their clinical behavior. And this might be, personally for me, one of the most important steps for the future.
Reviewing this year's DGU, what is the most exciting new data concerning bladder cancer in your personal opinion?
Let's say from the clinical point of view, from my opinion, there are two papers very interesting. One paper focuses on PDD. It's the paper from Garkis and co-workers from Tübingen, and they have investigated the outcome of patients who have been resected under PDD and afterwards had been cystectomized. And in their retrospective trial, they found out that the patients who had been resected prior under PDD will have a much better outcome with progression rate, with survival, compared to patients who have only been resected under white light. The explanation is not very clear, but this is quite interesting, even for science. Probably this might be a reason for a phototherapeutic effect of the used substance like Hexvix. So this is very exciting and interesting paper. Another paper was from the group of Gießen from Lüdecke, who investigated even in our time of BCG shortness so far the use of a device-assisted chemotherapy, which is quite interesting because their results are even much better compared to patients who have been treated only by BCG. And this is also a very exciting paper, and I'm looking forward to implement these treatment devices in our clinical daily routine use.
Do you see differences concerning bladder cancer management in Germany when compared to other European countries?
Well, if we will have a look on treatment modalities in Europe which are new in the European guidelines, PDD is one of the newest treatment modalities, and this might be a difference because in Germany we do use much more PDDs than in other European countries. In Germany we do approximately 100,000 TURBs per year, and 30% of these TURs are right now done in Germany by the use of Hexvix. So this is quite interesting. The explanation might be that that we do have a financial reimbursement if we are using PDD in Germany, and this might be a big difference compared to other European countries where there is no financial reimbursement. I'm personally convinced that if in other European countries they will have a financial reimbursement, they will do more PDD, and this is a difference.
At this year's BAU's annual meeting, Mariappan presented exciting data from a real-life experience demonstrating that recurrence-free survival at 3 years is significantly better with PDD TURBT when compared to white light TURBT. Does this reflect your real-life setting experience?
Well, it does not reflect my real-life setting experience, but it confirms the data of the B305 study, which has shown a significant reduction of recurrence rate after the use of Hexvix in a prospective randomized trial.
Optimized photodynamic diagnosis for TURB was also investigated in the optic 3NIS. Many of the cyst lesions were found by Hexvix-guided blue light cystoscopy only, and some non-muscle invasive bladder cancer patients were not identified with white light cystoscopy at all. What is the value of this data for bladder cancer management?
Well, it even confirms the prior data which have been gathered by always prospective or retrospective randomized trials. Nevertheless, this is daily clinical routine use. And the data are still the same, even in daily clinical routine use. And this is very exciting because we still have a higher rate of detected papillary tumor lesions compared to white light cystoscopy, and we still do have a 25% difference in favor of blue light cystoscopy with regard to the CIS detection compared to white light cystoscopy.